Osteoarthritis is one of the most common conditions that occurs in our spine as we age. It's characterized by the breakdown of cartilage in the joints and the disc. And initially, it results in an instability in the joint, and then as the condition goes on, there's a production of osteophytes or bone spurs. For decades, it's been believed that osteoarthritis is caused by an injury to the joint or wear and tear. And that makes sense in athletes or in people who have had jobs that require a repetitive motion through the joint. But what about the rest of us? Those of us who haven't been tackled on the football field or had a job lifting heavy boxes for UPS. Is there another reason that we develop an arthritic spine? Well, the answer might surprise you. There is emerging research that suggests that low-grade systemic inflammation is a major player in the development of osteoarthritis. Most of us are familiar with acute inflammation. That's the type of inflammation that occurs when we sprain our ankle, cut ourselves, or have a local infection. And what happens is the immune system is activated and sends immune cells, hormones, and nutrients to the tissue to fight off the invading infection and to heal the damaged tissues. However, chronic low-grade systemic inflammation is a low level of inflammation that occurs throughout the body. And it is not produced by an injury or an infection. It's produced by some other kind of internal threat. But what happens in this case is the immune system activates the immune cells, but then they have nowhere to go and nothing to do. And this might result in the immune cells attacking healthy tissue, like the joints of your spine and your disc. So these internal threats are numerous, but a couple that I want to point out are things like the failure to eliminate a previous infection or a virus, environmental toxins such as mercury and lead, food allergies, lack of sleep, stress, and a poor diet. The good news is that there are things you can do to help squelch this type of inflammation. Appropriate exercise, making sure you get enough sleep, stress management, and eating an anti-inflammatory diet. So an anti-inflammatory diet is rich in vegetables and fruits and legumes such as lentils and beans, also rich in nuts and seeds and omega-3 fatty acids. Omega-3 fats are known to be anti-inflammatory, so it's important to include foods such as salmon, mackerel, halibut, seeds such as chia seeds, flax seeds, walnuts in your diet for the omega-3 properties. It's not just enough to eat anti-inflammatory foods, but you also have to eliminate the fake foods that are inflaming us. Processed carbohydrates that are high in sugars, high fructose corn syrup, artificial sweeteners, artificial flavors, and preservatives. And most important is to eliminate vegetable oils, corn oil, soy oil, safflower oil, sunflower oil. These oils are high in omega-6 fatty acids. And even though omega-6 fatty acids are essential and we do need to consume some in our diet, excessive amounts of omega-6 fatty acids can actually cause inflammation. So if you are suffering with an arthritic spine or you just want to protect your joints, the number one thing you can do is to avoid fake foods that fuel the flame and douse inflammation with a whole food diet rich in fruits, vegetables, omega-3 fats, and drinking pure, clean water. So osteoarthritis, caused by wear and tear injury, but also inflammation. And the result is that first it creates an instability, and then the way the body that heals that instability is to lay down new bone to stabilize the joint in the form of osteophytes or bone spurs. Osteoporosis, also caused by inflammation, but also the decline in hormones as we age and multiple of other things. That is actually the bone loss. So it's not the addition of bone as it is in osteoarthritis, it's the loss of bone. So then your bones become weak and fragile and increases your susceptibility to fractures. Well, with osteoporosis, the very first thing you have to do is find the underlying reason why they're losing bone. And again, most commonly, people develop osteoporosis when they go through menopause and they start to have a decline in estrogen. And estrogen is very bone protective. And so when a woman goes through menopause and loses that estrogen, we lose that protection to the bone. But there are a lot of other reasons as well. So it can be from inflammation, it can be from a lack of exercise. So people that have sat behind desks their entire life and haven't had exercise. And exercise is critical because the force through the bone is what initiates bone turnover and makes our bones stronger. And on the other side of that is the muscle contraction. So resistive exercise is strength training. Every time you contract your muscles, you're not only pulling on the bone, which puts a force on the bone, it also releases a hormone called irisin. And this is brand new information. And we know, well, what we're finding out is that this hormone speaks to the bone and tells the bone to grow and get stronger. And this hormone is only released from the muscles and only works on the bone. So other things that can create osteoarthritis, stress, for instance, the high levels of cortisol. And we know that cortisol is a catabolic hormone, and it causes tissue breakdown throughout the body. And your bone is tissue like any other bone and any other tissue in the body. So cortisol causes the breakdown of bone. If you're not absorbing foods, if your digestive tract is not healthy, and you're not absorbing the nutrients from the foods that you're eating, then you're not getting those nutrients to the bones. And most people think that osteoporosis is all about calcium and vitamin D. But the truth is there's over 20 different nutrients that are important in maintaining healthy bone. So not only do we need calcium and vitamin D, we need magnesium, we need vitamin K2, because vitamin K2 is what takes calcium out of the bones, out of the blood and puts it in the bones. But we need zinc, we need selenium, we need manganese, a whole host of nutrients. So people that have just been told to, take your calcium supplement, it's just not enough. But on the other hand, we can give someone the most perfect diet and all the correct supplements, but if they are not able to absorb them due to a digestive issue, then that can create osteoporosis as well. Bone health in general, a whole food diet. A diet rich in fruits and vegetables, legumes, nuts and seeds, good healthy fats. Not only the omega-3 fats, but also fats that come from olive oil and avocados. And there's been a lot of studies in regards to osteoporosis that a diet high in extra virgin olive oil has been shown to diminish bone loss. So I would say number one thing is a whole food, high vegetable diet, good healthy fats. Exercise is absolutely essential. You want enough exercise, but you don't want to overdo exercise. And stress management. Stress is an underlying cause of so many of our health conditions. So making sure that every single day you do something you love to do. And it doesn't matter what it is. It can be a walk in the woods. It can be a funny sitcom that you watch on television. It can be a good book. It can be prayer. It can be meditation. Just do something every single day that brings you joy and helps to reduce your stress. Well, not only have I had 2 lumbar spine fusions, the first one was in 1996. So I'm, a pretty good example that it can help. And I think the thing that keeps me pain-free every single day is exercise. It's building a core, a strong core, and making sure that I maintain, a strong core, strong legs, and use appropriate body mechanics when I go to lift something up, or, avoiding bending and twisting. And then, of course, a diet. I strive to eat a diet that is very nutrient rich and anti-inflammatory. I also have osteoporosis. So again, taking the correct supplements every single day, not just calcium and vitamin D, but an array of supplements. I do a lot of testing. So one of the tests that I do is a comprehensive stool analysis to make sure that my gut is healthy. And so if I find that I have an overabundance of bad bacteria and not enough of the good probiotics, I can treat that accordingly. So I make sure I keep my gut healthy, I make sure I eat a good diet, and I do practice stress reduction every single day. I walk in the woods, I meditate every night before I go to bed, and I say my prayers as well. Because antibiotics are against all life, and we need to have a healthy population of good bacteria in our gut. So when we take an antibiotic, and they're important sometimes, but they wipe out everything. And when you wipe out all the good, the bad bacteria and the fungi and the yeast can overgrow, because the good bacteria help to keep all of that at bay. So anytime that you've been on an antibiotic, making sure that you follow that up with probiotics. And what's really interesting, fibers. It's fiber that feeds the good bacteria. And there was a study done in some rural area tribe in Africa. And they were on a plant-based high fiber diet. And they went in and they switched out, well, first they tested their gut microbiome, then they switched out their diet. They gave them the sad standard American diet, high in processed foods, low in fiber. And then they retested their gut microbiome and saw that it was a mess. They then put them back on their traditional plant-based diet, and voila, the gut microbiome went back into a normal, healthy state. One of the things that I think people need to be aware of is eating foods that have a lot of pesticides in them. So, a lot of people will say they're sensitive to gluten, and a lot of people are going on these gluten-free diets. And it actually may not be the gluten that's the issue. It may be the pesticides that are sprayed on the crops that when we consume destroys our gut microbiome. So one of the pesticides that's creating a lot of issues right now is glycosphenates, okay? So these are Roundup, when we hear Roundup in our oatmeal and Roundup in all of these foods. And they actually not only spray Roundup on the crops during the growth time, but also 2 weeks prior to harvesting the crops, because it helps to dehydrate the crops and make it easier to then harvest the crops. And when we eat foods with these pesticides on it, these pesticides destroy the good bacteria in our gut. And so it may not be the gluten that's the issue, but the pesticides that are coming in on our food, that's the issue. And then also, again, stress, cortisol, all of those things can disrupt the gut microbiome as well. Movement after surgery is really important. One, because we need blood flow and we need circulation, because we want to prevent DVTs and blood clots. And those are, those can be created through a surgical procedure. But also starting to get range of motion in the joints. So if someone's had a total knee replacement, you've got to start getting motion back in the joint. In terms of spinal fusions, obviously you don't want motion in the joint after those. But again, the movement and walking is going to help increase circulation. And when you have an increase in circulation, you get nutrients and oxygen to those tissues, which help with the healing process. And I do have a whole handout on post-surgical nutrition and making sure that people are getting enough protein. And we need more protein after a surgery than we need on a daily basis. And sometimes it's hard to get the food that we need because of nausea and pain medications. So, doing things like making smoothies with greens and protein powder is really important. And then one of my all-time favorites is bone broths, and we've gotten away from this, with all of our modern day foods, but people used to make bone broths all the time, hundreds of years ago. And the great thing about the bone broth is all of the collagen and minerals that hold that bone together and make that bone hard when you cook down the bones ends up in the broth. And you can either just drink the broth as is, or you can use the broth to cook with. So if you're making a chicken soup or a stew, or maybe cooking rice, quinoa, lentils, you can use that broth as the liquid, and then you get that extra value from the broth. So I think the most common misconception is all I need is calcium. And all I need to do is drink 3 glasses of milk a day, eat cheese, and eat yogurt. And milk tends to be a very inflammatory food, or dairy in general tends to be a very inflammatory food. And a lot of people have underlying milk allergies. So if you just think, oh, I'm just going to drink all of this milk, you're actually doing your body more harm than good. And the other thing that I've seen over the years is doctors will just say, oh, take 1,200 milligrams of calcium and take some vitamin D. Well, what we've seen is the rise of cardiovascular disease when people are taking this much calcium. And the reason is because you're taking a great amount of calcium, but you don't have the cofactors or the other nutrients that are going to take calcium out of the bloodstream and drive them into the bone. So calcium is staying in the vessels, creating calcifications in the vessels, or in other tissues such as the kidneys, creating kidney stones. So I think out of every misconception, people have to understand that calcium and vitamin D are not the be-all and end-all to preventing osteoporosis. It takes an array of nutrients. So I think the other thing that we're finding with the Dexa scans, so the Dexa scans are the gold standard in terms of diagnosing osteoporosis. But the Dexa scans only look at density. They don't look at bone quality. And I've actually had patients that have had low bone mass, or sometimes called osteopenia, that have sustained multiple fractures. So they don't even have osteoporosis. And then I've had patients that have, pretty significant osteoporosis, and they've fallen and they've never sustained a fracture. And the difference is the lifestyle and the diet that they're eating. So my osteopenic patient drank alcohol, processed diet, a lot of stress in her life, and very little exercise. So all it took is, even though she didn't have osteoporosis, just took a slip and fall and she breaks a bone. Whereas on the other hand, my osteoporosis patient, who was, exercising every single day, eating a great diet, performing stress management, taking the correct supplements, a slip and fall in her, and she did not sustain a fracture. So it's not all about bone density. It's also about the quality of bone that you have. And unfortunately, we right now don't have a way to measure bone quality, only bone density. Bones aren't sexy. They lie deep down inside. Nobody thinks about them until the doctor says, oh, you're 52, you should have a Dexa scan, and voila. But the truth is, bone health starts as an adolescent. And what's interesting is we form the most amount of bone that we're ever going to have by the age 24 in women and 28 in men. So our teenagers that may be anorexic, or, not eating enough healthy foods, or not doing exercise, they are not building their bone bank. So we call it peak bone density. So, and I like to use the analogy of a bone bank. So up till the age of 24, you have to fill that bank with as much bone as you possibly can, because then later in life, when you go through menopause, you inevitably are going to lose some bone. But the more bone you have, the more bone that you've put in your bone bank, when you start to lose bone, you're still going to be okay. But those who didn't reach peak bone mass or peak bone density, didn't fill their bank with bone, now they're starting at a lower amount of bone, so when they go through menopause, it doesn't take much to put them into osteoporosis. And in terms of men, you know, we talk about menopause all the time in regards to women, but men go through hormonal changes too, called andropause, and they start to get a decline in testosterone. And just like estrogen in women, the testosterone in men also help to protect their bones. So they as well can lose that protection, and if they're not exercising and they're not eating appropriately and have high stress levels, they can develop osteoporosis as well. But unfortunately, you know, it's atypical for a man to get a Dexa scan. I do think that there's increased awareness these days, and I think more and more physicians are recommending Dexa scans for men if they feel appropriate, but it's not a common test as it is in regards to women. So there is a correlation between diabetes and osteoporosis, and the underlying reason for that is diabetics have difficulty controlling their blood sugars. So when you get a high circulating blood sugar, it is very inflammatory, and inflammation can cause bone loss. So what inflammation does is it actually inhibits the osteoblasts, or the cells that produce new bone, and it heightens or excites the osteoclasts, which are the bones that break down cells. So anything that causes inflammation can cause a breakdown in bone, and diabetes absolutely creates inflammation in the system. Number one, we have to stabilize their blood sugars. And typically it's, you know, when you get a diet from somebody that has diabetes, it is high in processed carbohydrates. And you really need to eliminate foods that cause an increase of blood sugars. And the other thing that I'm a big proponent of is making sure that every meal contains a protein, a fat, and a carbohydrate. And the reason is, I like to have the analogy of building a fire in the fireplace. So the first thing you do is you put down your logs, and it's the logs that are going to burn for hours. But to get those logs burning, you need to have kindling. And so you put on the kindling, and the kindling burns very hot, but very rapidly, and then it's gone. So your carbohydrates, particularly your processed carbohydrates, or the carbohydrates that don't have a lot of fibers in them, they are your kindling. And your protein and your fats are your logs. So when you have a meal that's just carbohydrates, so you eat your Wheaties for breakfast, they're going to burn very hot, very fast, cause an increase in blood sugars, and then you're going to go into a hypoglycemic mode, and you're going to be feeling fatigued and shaky, and then what the body is going to say, well, you need more carbohydrates to bring your blood sugars back up. If you have a meal that has protein and fat in it, the protein and the fat take longer to digest. So they're going to slow down the digestive process, and instead of having a spike in your blood sugar, it's going to be a gradual increase, but it's not going to go to the same high levels as it would if you were just to have a pure carbohydrate meal. So that way, you don't have the spikes in blood sugar, and you get a much more stable energy. You're not going to have the highs and the lows that you would typically have. So we were talking before about how important the gut microbiome is, but the digestive process is just as important. And we see a lot of people that have indigestion and reflux, and they take antacids and medications to kind of squelch the acid in the stomach. But we need acid in our stomach, not only to break down proteins, but also to do something called ionize our minerals, particularly calcium, so that they can be absorbed. And if you're not producing enough acid in your stomach, or you're taking antacids, then you're not going to break down your proteins fully, and you're not going to ionize your minerals, so they're not going to be used in the body. And their studies have shown a positive correlation between antacids and osteoporosis. So if you have digestive issues, let's figure out what is causing them. Are you overeating? Are you allergic to something that you're eating? And possibly you may not be making enough acid in your stomach. It may not be the overproduction of acid, but the underproduction of acid. So we have to get to the root cause of why you're not digesting properly, because it all starts with digestion. If you cannot digest your food, you can't absorb the nutrients, and those nutrients aren't going to get to your bones. So there is a lot of research there. And most people think that, or most people have the picture of a woman with osteoporosis as being small and thin. And that kind of makes sense because, when you're smaller and thinner and lighter, you don't have the same amount of impact through your bones with every step that you take, so you don't get that bone turnover. And you would think that obese women with all of that weight would create a greater impact through their bones and less likely to develop osteoporosis. But what we're actually finding is there is osteoporosis in people that are overweight. And one thing that we're seeing is what's happening is people are getting fatty bone. And the same cells that produce bone cells also produce fat cells. And something is stimulating these cells to turn into fat and not into bone. And so this is a whole area of emerging research that we're just starting to learn so much more. But yes, I have seen osteoporosis in people that are overweight as well as people that are underweight.